listening to someone, just hearing their story. If you can't do something right then, you may know someone, or simply just offering, whatever you may have, even if it's just a little bit, it truly does add up to making a great change in our community.
Hey everybody, this is Corey Dion Lewis, founder of The Healthy Project and host of the Healthy Project podcast. Now, before you listen to this great interview, I'd like to talk to you about My City, My Health. The My City, My Health conference presented by The Healthy Project will educate the audience about what health and community advocates are doing to improve the health of the most vulnerable and underserved in our communities. There will be multiple panels discussing topics around culture and healthcare, mental health, prevention, and how we're collaborating with community-based organizations to really make a difference in our community. If you want to learn more about this in-person and virtual experience, you can go to mycity.health. If you want to have this conference in your city, email me, Corey@thehealthyproject.co. and we could talk more about how we can have a My City, My Health experience in your city, talking to the health and community leaders in your city about what you can do to improve the health of the people in your city. Again, thank you for supporting the Healthy Project.
Thank you for tuning in to the Healthy Project, My City, My Health edition. I'm Krisha, and I'm going to be your host. I'm a junior at the University of Iowa, majoring in psychology and minoring in gender, health, and healthcare equity. I would like to thank Chayla for joining me this morning. Before we get started, would you like to tell the listeners a little bit about yourself?
Sure. My name is Chayla Morris. I currently work at Broadlawns Medical Center as their clinical pharmacy coordinator. So I'm working to implement different pharmacy-led initiatives throughout the hospital, specifically focusing on outpatient or ambulatory care services.
That's super exciting stuff. I know we're
Thank
here
you.
today to talk about the My City, My Health conference, and I was wondering if you could share what this conference means to you.
Absolutely. So I'm a native of Des Moines, so it's really exciting for me to see a group of local and community leaders coming together to discuss health equity and things that we can do to impact the patients in our community. I've seen Des Moines change a lot over the past, 10 to 15 years. So now that I'm able to have a little bit more of an impact as well, again, it's just really exciting to see all of us coming together and having these discussions, because I truly think it's so important.
Yeah, I bet it definitely does mean a lot since you're originally from Des Moines and then you're able to be part of this conference. It's really exciting stuff. So how do health disparities show in your work as a pharmacist, and what business issues are at the forefront of your work?
Yeah. So pharmacy is a very patient-driven profession. We're some of the most accessible healthcare workers and providers that are, really in the community as well as in hospitals and things like that. Personally, in my job, again, I work at Broadlawns, which is a county hospital. So we're seeing about 70% of our patients having Medicaid or Medicare. And so a lot of those patients may have issues affording some of their medications, specifically if they are in a high cost area such as oncology, or they have multiple medications, which we definitely see. So we're working with our patients to find medication assistance programs or other financial assistance programs. In addition to, sometimes they have other issues outside of their health that they may not be able to afford, or having problems with getting resources. So even though our focus is, of course, on their health, making sure that they can do what they need to do to stay healthy, we also try to make sure that we're addressing those other areas as well. So that's some of the things that we do at Broadlawns. And then in general with pharmacy, there are a couple of issues. Sometimes we may not always get reimbursed for qualitative services outside of, just dispensing a medication. But I think that there's been a lot of recent change and some legislative change as well to make sure that not only pharmacists, but other healthcare professionals are getting reimbursed properly so we can continue to offer those services to our patients.
Yeah, I know you were mentioning kind of looking at other aspects of the patient's life. How has COVID kind of complicated that a little bit?
I think COVID really exposed a lot of issues that were already occurring. It just threw it all to the forefront. So with COVID, people weren't going to hospitals, doctor's appointments, people weren't going anywhere. So, if they may have unfortunately lost a job, now we've got transportation, food issues, accessibility to really anything that people may have taken for granted on a day to day basis. Or again, if someone was already struggling, COVID really just kind of smacked them down during a time where we were all struggling together. So luckily, over the past, couple of years and somewhat more recently, we've started to see a shift back to whatever normal was, if we could even call it like that before. But I think it just really provided a lot of awareness for people who may have been fortunate enough to not recognize issues that a majority of our country faced on a day-to-day basis.
Yeah, I really like how you mentioned exposing issues that were already there. Like these were already
Mhm.
happening, but it kind of just like
Exactly.
heightened them a little bit.
Right. Those cracks really opened up wide. And so a lot of people were able to see, the inequities that we already had in our healthcare system, issues, just like you mentioned, were already occurring. So now that those things have been exposed, we've got people that are able to make change and make a positive impact. They're able to see those things and really make a difference.
Yeah, so I know you mentioned that health leaders like yourself are trying to make progress towards impact drivers of health. What are some of the challenges you face while you do this?
Number one challenge is probably always funding. It's very hard to fix things on a large scale if you simply don't have the resources or money to do so. But again, because I think a lot more people are aware, there have been some changes. So I mentioned a couple of state and federal legislative changes. There's been more bills being introduced to address these inequities. And I feel like there's been a lot more grant funding available, even at the local and community levels, so that people can expand different services, whether that is helping patients get to and from the hospital, right? So transportation issues. I mentioned the patient assistance programs that have always been available through manufacturers and other federal grants, but I think those are being more widely used. And so, for example, here at Broadlawns, we're trying to centralize our patient assistance program to really have it as an available service for any patient of Broadlawns. And so that those people are recognized kind of at their entrance through the door versus having to get a procedure or a medication on the back end and they're like, I can't afford it. So I think those are some things that we've been trying to do, but certainly funding is definitely an issue.
Yeah, if you had unlimited money, I think things would be a lot
Oh
easier. But
man.
unfortunately, that is not always a reality.
Definitely not the reality. But I think that, enough people are recognizing even small impacts that they can make. And so when you add up all of those things, it really does make a long-term difference. And I think the name of the game is sustainability, right? We don't want to just do something just to do it for this moment and say, good job, and pat ourselves on the back. We want to make sure that whatever we're setting up in place for our patients and our community, we're able to sustain that long term.
Yeah, like this is obviously a huge problem, but there are like small things that we can do to kind of make things a little bit better. So
Hmm.
I feel like it's important to break it down into smaller parts just so it doesn't get super overwhelming.
Absolutely. I tell my patients that, all the time, any sort of little progress that you can make is going to help you in the long run. And it's the same with health equity. We can't change the world overnight, unfortunately, even though we all want to. But it's little things that we can do each day and over time that will hopefully make our system better.
So far, I've been feeling super inspired by everything that you've done in your community. And are there like ways for community members to get involved with these efforts to help reduce these health disparities?
Absolutely. Just like we said, any little bit makes a difference. So I think the first thing to do is simply get knowledge about what's already going on in your community, because I guarantee you there's a lot more things than you probably realize. So just taking the time to do some research. What are some nonprofit organizations in your community, whether that is helping out, with schools and education. I know we just had, I believe it was Back to School Iowa, where they were giving out free backpacks for kids and making sure that they had school supplies. There are, different organizations that you can volunteer your time with, whether that's, again, something, providing transportation, helping with a particular community, such as veterans or refugee populations. In Iowa, we've had such a large amount of refugees come in, through Afghanistan and other countries. So just finding different organizations that are already doing the work and then offering, whatever service you feel that you may have, even if you think it's not a big deal right now, I guarantee you it's making a difference in somebody's life.
Yeah, for sure. There's like small things that we can all do to kind of help combat this bigger issue at hand.
Hmm.
I know that we discussed like many different strategies and potential solutions this morning, but what's one thing that you'd want your listeners to take away from our conversation today?
I would say that the one thing to take away from this is, again, you can make a difference in whatever you feel that you have to offer. Even if you think, you are pretty busy or you're not exactly sure what skill set you can offer, and you feel like health equity and trying to, save the world is something very difficult. I guarantee you there is something that you can do to help contribute. And again, it's just learning about the different opportunities that are available, even if it's just volunteering your time, listening to someone, just hearing their story. If you can't do something right then, you may know someone, or simply just offering, whatever you may have, even if it's just a little bit, it truly does add up to making a great change in our community.
Yeah, for sure. It's like important to just get started. And I feel like once you take that first step, it's often the hardest, but it's a lot easier to like get going from there.
Exactly. If you look at, the grand scheme of things, it definitely seems very overwhelming. So that's why I feel like just starting with something small, again, is that first step. Whether that's a patient, you're trying to get, make health care goals or changes in your life, or again, you're just wanting to contribute to improving your local community.
Yeah, for sure. Well, I'd like to thank you so much for joining us this morning.
Yeah, thank you so much for having me. I'm very excited for the conference.
I'm excited too. I'll be joining virtually.
Oh, perfect.
Thank you for joining us this morning. And as a reminder, you can come to the My City, My Health conference that's happening on November 11th from 9 a.m. to 3 p.m. to meet more of Des Moines' most influential health and community advocates.